Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending February 18th, 2021. I'm going to pose and answer several questions this week. How is the pandemic progressing globally in the U.S. and in our region? Should we be comfortable with the fact that the numbers are slowing down? And how concerned should we be about the evolving variants of the virus? And I'll give a quick reminder on the COVID-19 vaccines. In terms of the pandemic, we have passed 2,400,000 deaths worldwide and an almost unimaginable 110 million known cases and many more. The week-to-week growth rate has slowed down as we've been watching. Over time, it has gone up and down a little bit, but in the last couple of weeks, it's gone down consistently. And a 3.2% week-to-week growth rate means we'll be doubling in about 22 weeks. So slower, much slower than it has been before. And if you look at this pattern, you can see here the daily number of deaths went up from about October through December, and now have been coming back down fairly consistently. In terms of the U.S., unfortunately, we have passed an unpleasant milestone of 500,000 deaths. Almost 20,000 deaths last week alone, and a 4% week-to-week increase. So we're increasing slightly more in the U.S. than in the world overall, but the good news is the rate in the U.S. has also been coming down for the last couple of weeks. And at a 4% growth rate, our doubling time would be about 18 weeks. And again, you can see this pattern of increasing number of daily deaths from October through December into January, and then been coming down since then. This is from August, September, October, November, December, January, February, where all the cases have been, and then here are where the cases have been the last 2 weeks. And you can see it's a much nicer pattern than we've seen in the past. Again, if we go back from August, September, October, November, December, January, February. It's been slowing down pretty consistently. And in our region, again, for about the third week in a row now, we don't look like one of the worst parts in the country. If we look at our states in our immediate area, the total number of deaths, and if we look at deaths per million, we continue to see that Tennessee leads the pack, slightly ahead of South Carolina, and fairly consistently 50% or more ahead of the other states. Fortunately, the week-to-week growth rates have slowed down as well in all of our states. In terms of the ballot health area, 1,762 deaths, and again, a very modest 2.4% increase in the past week. And at this rate, we'll hit 2,000 deaths in about 6 weeks. So we are seeing this slowing down globally in the U.S. and in our region. Well, should we be comfortable with that? Right, as I pointed out, in each case, we're seeing this several month pattern of slowing down, right? Whether it's globally, in the U.S., or in the most impacted countries in Europe. But I want to point out something, okay? In almost every case, whether it's the world, even though it's coming down, the daily number of deaths is still about as high as it has ever been. And I would point out that there has been a spike before, came down, went back up, again came down, went back up. Same in the U.S. A spike back in the spring, came back down, a smaller spike in the early summer, and a bigger spike. And then if we look at what we've seen in the European countries, again, months where there were very, very few cases, and then this explosion. So while we can be optimistic that things are slowing down, we really don't know what's going to happen, whether we're going to see other spikes and waves. This is not the time to let up on the things that we know make a difference. And one of the reasons for that is these evolving variants you've heard a lot about. There's sort of 3 variants that are important to us. The one called the UK variant, we've had over 1,000 cases in 42 states in the United States, including in our region. The South African variant, less common, but still fairly widespread. And then the Brazilian variant, much less common. The UK variant appears to be spreading more easily and more quickly, and early evidence, though it has not yet been confirmed, suggests that this may be associated with an increased risk of death. So we don't want to let this variant spread a lot because it could spread more quickly and be more lethal. It was detected first in the US in December. The South African variant, 19 cases in 10 states. It looks shares some commonality with the UK variant, and it was reported in January of 2021. The Brazilian variant contains mutations that may affect its ability to be recognized by antibodies, and it was first detected in January. The reason I point all of this out is that these variants are potentially very important, because if we get a variant that is substantively different, it may spread more widely, it may be more lethal, it may even avoid protection by vaccine and natural immunity. So the CDC says rigorous and continued increased compliance with public health mitigation strategies such as vaccination, physical distancing, masks, hand hygiene, isolation, and quarantine is essential. These things are as important now as they've ever been, because we have to be concerned about these evolving variants. One of the key strategies, of course, is getting people vaccinated. If we can control the variants we have now, these new ones may not have a chance to appear. So it's important that we get vaccinated now. It's important that we practice these habits that we know make a difference. For those of you who have questions about the vaccines, please tune in to a webinar next Tuesday from 6 to 7:30 Eastern Time. The link is there. You can when you go to the link, you can submit your questions in advance. I encourage you to do that, because I will share the questions with our speakers, and they will be able to address as many of them as time permits. So if you have questions about the vaccines, please log in and share your questions with us. There's a great deal more information about COVID-19 on the College Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know. We're happy to share this information with anyone. As always, I'd like to thank Melissa White for helping to collate the data, and Dara Young for editing, producing, and posting these videos. And if you have any questions you'd like to see us address in future weeks, please let me know. This is where these questions come from. Many times I will try to answer your questions by return email, but if they're questions of general interest or importance, I'm going to put them in these future videos. So thank you for those questions in advance.